Thank you to Congressman Pallone. I am Meredith Berkman, co-founder of Parents Against Vaping, and I am now really excited to get into an interesting and important conversation with our partner and friend, Professor Dr. Stan Glantz, who in addition to his 40 or so years of tobacco control and research, is the founding director of UCSF's, of course, Stan, I don't have the name written in front of me, but of the UCSF tobacco control, you'll have to say the name, so I apologize. That's what happens when you know someone well. But what we're going to talk about today is really the health impacts of vaping, because we've talked a lot about industry tactics. We've talked a lot today about predatory behavior. But when it comes down to it, the thing that frightens parents the most is what are the actual physical and psychological harms that these e-cigarette products are potentially doing or have already done to our children. So Stan, I'm going to jump right in. I'll just sort of summarize some of the conversations we've had about this. We know that e-cigarettes generate these ultrafine particles, these aerosolized bits of nicotine that are inhaled very, very deeply into the lungs. And that's because the nicotine in the e-cigarettes is dissolved in a mixture of propylene glycol and vegetable glycerin, right? Known as PGVG, usually with flavors, and those are mostly proprietary. We have no idea what chemicals are in those. And this combination, because of the delivery system, very rapidly boom, goes right to the brain. And we know that with cigarettes, we're talking about they generate aerosol by burning tobacco. So there's lots of toxic combustion products that includes many carcinogens and solvents, right? That's nothing new. We already know that. And because e-cigarettes don't set anything on fire, because they're non-combusted, tobacco companies and e-cig advocates, and maybe even, I think your point is FDA, assumes that they're a lot safer than cigarettes. So I want to sort of set the table. If someone said to you who has never used tobacco, I'm going to smoke or vape, no matter what you say, which will do the least harm, you've said, well, you're better off probably and no worse off with an e-cig. But the question is, are they a lot safer? And your answer is probably not. They're just different. And really the most important point here is we're talking in all of our advocacy and all the things we've talked about today, we're talking about youth. We're talking about a generation that would otherwise not have been initiated into tobacco use, but for Juul and all of the products that followed. So how does knowing that we're talking about youth when we're looking at these harms, how does it change your answer? How does it change the conversation about how harmful these products are? And knowing that, what should FDA do about them?
Well, as you summarized so nicely, the way an e-cigarette works is it delivers an aerosol of ultrafine particles to carry the nicotine down deep into the lungs, where it gets absorbed and very rapidly goes to your brain, which is what leads to the addictive effects that other speakers have been speaking about. And as you also said, the difference between an e-cigarette and a cigarette is the cigarette generates a similar aerosol, but by burning the tobacco. And so it's true that you don't get the combustion products that a cigarette generates when you smoke an e-cigarette. And a lot of these combustion products are carcinogens and very strong irritants. And the assumption that the FDA has made and that the e-cigarette advocates push is because you don't have those combustion products, it's a lot safer than a cigarette. Well, it turns out that as you said, it's just different. And the propylene glycol vegetable glycerin mixture, when you aerosolize it, inhale it, a lot of the flavoring agents, which are perfectly fine to eat, But when you aerosolize them and breathe in these ultrafine particles, which are very, very tiny, they're about a hundredth the size of a human hair, they just tear up your lungs and they trigger inflammatory processes, they depress immune function, and and they make it easier to get infected. They also affect blood vessels and blood platelets in ways that reduces the ability of your cardiovascular system to adapt to changing needs. They increase over the longer term the risk of getting heart attacks or strokes. And those ultrafine particles are themselves tremendously dangerous, independent of how you generate them. For example, if you have a day with a high level of ultrafine particle air pollution, more people end up in the hospital with heart attacks, strokes, and respiratory problems. And these are changes that occur right away. And in terms of the effects on blood vessels and the cardiovascular system, it looks like e-cigarettes are essentially the same as cigarettes in terms of the actual impact they have on the functioning of your body, even though the details are a bit different. But the adverse effects on the ability of your blood vessels to function are essentially the same. The effects on respiratory function are very, very similar. And while there probably is a little bit lower cancer risk, they've already been able to induce lung cancer in experimental animals with e-cigarettes. And there have been studies done looking at the genes in your cheeks, which get turned over very quickly. And it turns out that if you're a smoker, about 1,100 genes cancer-related genes are adversely affected. With e-cigarettes, it's less. It's about 800 or 900. So there's a little bit lower cancer risk. But the most interesting thing to me is that most of those genes are different. So the e-cigarettes are actually having different cancer effects than the cigarettes are. And in fact, there's even some evidence, which in fact the FDA cites in its PMTA that it granted for logic cigarettes and then just sort of blows off. But they seem to be having adverse effects on liver function that cigarettes don't have. So, an e-cigarette, as I said, if you put a gun to my head and said, I'm going to use an e-cigarette or a cigarette, which is worse, the cigarette is worse. But is it a lot worse? Probably not. It's just different.
So, right. So that's interesting. I actually didn't know that about the liver. One of the things when you talk about the risk of cancer, of course, with 2020 hindsight, everyone says, well, cigarettes cause cancer. We know that we knew that years ago. And that's why that's one of the motivators for people who, either never started smoking or stopped smoking. What's so scary, I think, for parents is that we don't have the long-term research. It's bad enough what you just laid out for us, but we don't have the long-term research about the harms, the physical harms that the negative health consequences that e-cigarettes will have long-term. And so I think we've used this term before. Our kids are basically being used as science experiments or lab rats for this e-cig experiment. Do you think that's true?
Well, it's sort of true, but I think, the thing you got to remember is e-cigarettes have been on the market for 15 or 16 years now. And so we do have some long-term research about the effects, and you have to look at different disease outcomes. There's cardiovascular disease, lung disease, and cancer are the three main categories of adverse, and then also complications of pregnancy. And it's true that the cancer risks evolve very slowly over a period of several years. But the cardiovascular risks and the effects on your lungs occur very, very quickly. If you use an e-cigarette, your cardiovascular system is working worse 30 seconds later. If you quit smoking or quit using an e-cigarette, the effects start to resolve. And if you quit smoking, for example, half the excess heart attack risk is gone in a year. So there are actually a bunch of epidemiological studies showing that e-cigarette use is associated with more asthma, more chronic obstructive pulmonary disease, and more lung disease generally. And that work has been done both in youth and in adults. There's fewer studies, but there are studies showing e-cigarette users are at an increased risk of having a heart attack.
Even young people, do they have to do
Well,
those studies for the
no,
same for
because young people don't get heart attacks. I mean, most people, you don't start to actually have heart attacks until if it's very early, you're in your 40s. I mean, in the 50s. So part of the problem is that, you know, the e-cigarettes are used predominantly by young people, but you're seeing these adverse effects on the cardiovascular system. But if you look at the very large population-based studies, which do capture enough people that are old enough to have heart attacks, they show increased risk of heart attacks, particularly if you're a dual user. That is, if you're using e-cigarettes and cigarettes at the same time. And you know, one of the great fallacies of the FDA's decision making on e-cigarettes is it assumes if you're a dual user, that is, if you're using cigarettes and e-cigarettes together, which is the dominant use pattern among adults. Kids are mostly sole e-cigarette users, but adults are mostly dual users. The FDA assumes dual use is not as bad as smoking, but in fact, what the studies consistently show is dual use is worse because you're getting all of the different adverse effects of the cigarettes, and then piled onto that, you're getting the different adverse effects associated with e-cigarette use. The one vascular effect, which has been shown in younger people associated with e-cigarettes, is erectile dysfunction. And that's because of these immediate effects that e-cigarettes have on blood vessels, which is very well documented, both in human studies and also in experimental animals.
And in terms of blood vessels, there's also the risk that you could have complications for healing, wound healing. That's a different relationship to blood vessels, but also an issue with vaping, correct?
Right. Your blood vessels are constantly getting bigger and smaller in response to changes in the need to get blood out to your muscles and your organs, and then to get rid of waste products. So if we're all sitting here right now, you don't have a lot of need for blood flow. So your blood vessels are small in order to maintain your blood pressure. When you get up and walk away or run away, you need more blood flow, and so the blood vessel, the blood speeds up, and the sped up blood, there's a friction against the lining of the arteries, and that friction causes something called flow mediated dilation, and so your blood vessels get bigger to accommodate the additional need for flow. And that process is just clobbered when you're an e-cigarette user or a smoker, or breathing a lot of diesel exhaust. It's all about the same. The wound healing, the effects of wound healing are a different manifestation of these adverse effects on small blood vessels. It's in that you're messing up something called the vascular endothelium. And when you do that, that plays an important role in healing too.
Right. So,
and if you've compromised that, you think if you have a wound, it just doesn't heal as well. That's why, you know, some surgeons, this is for particularly an issue in breast surgery. I don't know why, but it's particularly an issue in breast surgery.
You have to stop smoking and vaping before they'll do the surgery.
Yeah, a lot of surgeons won't operate on women while they're still smoking or vaping. A lot of cardiac surgeons won't operate on people while they're smoking and vaping because it really increases the risk of complications.
Right. So Stan, I have 3 questions in the chat that are really important and specific to a conversation about youth and e-cigarettes. And since we don't have enough time, we never have enough time to hear your wisdom. I'm going to just sort of put all 3 out there and let's see how much we can get to.
Okay.
One question is about the risk of Eval, which obviously we heard a lot about pre-COVID when the CDC was tracking on a weekly basis. We know that there are dozens upon dozens and dozens of these cases out there that aren't being tracked in by the CDC. So you have to sort of hunt around for them. We recently heard that, the New York City Health Department, an official said, well, we're probably seeing like 30 or 40 a year. Someone else is also asking about short-term effects, physical effects. I'm thinking of people who tell us all the time, my child was a track star and now they can't run a mile, or their asthma got worse. And then the last question, so they want to know the short-term effects that would be really influence youth who use e-cigs. The last question is about, is there a renewed call to action about symptoms associated with seizures? Because this was something that FDA talked about. I was actually going to bring that up myself. This person says, I work with youth who are reporting symptoms associated with nicotine toxicity and nicotine poisoning that could have a seizure risk. And they're talking about, should there be a universal screening tool for this? That's a lot to unpack, but I think the point is for kids, we're talking about Eval. Is that still a risk? Should we be concerned about that? The asthma, the short-term impacts, and then seizures. Maybe you could quickly give us your sense about those.
Well, let me.
If we had 3 days, we could take all that time.
If we had 3 days, yeah. Well, let me take the second question first, and that is, what are the short-term effects on ability to exercise? Because people have found that when they use e-cigarettes, the kids can't exercise.
Right.
And that's a direct consequence of these adverse effects on blood vessels. Because when you're exercising, if you're out running or exercising, you need a lot of blood flow to your muscles in order to get oxygen to the muscles and to transport the waste products of exercise away. And if your arteries can't dilate, if your arteries can't get bigger in order to accommodate the increased need for blood flow, you're not going to be able to exercise as well because you're not going to get the oxygen to the muscles and get rid of the waste products. So that's very easy. And that is an immediate manifestation of these adverse effects on blood vessels that e-cigarettes cause, just like cigarettes do. And that's one of the most immediate effects. And that happens within maybe 30 seconds of taking a puff. These effects occur very quickly, and they max out very quickly.
These kids aren't taking just one puff. That's the problem. It gets worse and worse and worse, right?
Well, I mean, people have studied this, and one puff is probably not enough to cause these effects, but probably 3 or 4 puffs is. It's not like it takes like weeks or months. This happens within seconds or minutes. The Eval question, it's what causes the Eval? There are cells in your lungs called macrophages, which go around and gobble up bacteria and help keep your lungs clean. And what happens in Eval is that macrophages get filled up with fat, and that it stops their ability to gobble up bacteria and viruses. And it also, they kind of clog up your lungs. And the one of the things, and probably the most important thing that was shown to lead to these, they're called lipid engorged macrophages, is a chemical called vitamin E acetate, which is used as a solvent in marijuana e-cigarettes. And so most of the Eval that occurred was in people who were using vaping marijuana.
But not all.
That's right, but not all. And these, about 10 or 15% of the documented Eval cases were in people who didn't use marijuana. And there are experimental studies that have been done to show that using e-cigarettes also creates lipid-engorged macrophages, just like vitamin E acetate does. So, you know, most of the EVALI that got documented was probably because of marijuana vaping, but there's still, and this is the CDC's official position,
Right.
you know, that vaping vaping nicotine could also likely cause some of the EVALI. In terms of the seizures, seizures are a symptom of nicotine overdose. And the one thing about a cigarette, the one kind of good thing about a cigarette is there's a limit to how fast you can consume nicotine, because it's governed by these physical processes. You take a puff, it takes a while to like take another puff. So there's a limit to how fast you can absorb nicotine from a cigarette. And also when the cigarette's used up, it's pretty obvious that people stop. That's not true with these cigarettes. There's no limit to how fast you can consume the nicotine. And in fact, it's interesting because when Juul was in development, there was some discussion at the company, according to the Lauren Etter's book, The Devil's Playbook, about actually programming the Juul to limit how frequently you could puff it, right, in order to avoid acute nicotine poisoning. And they decided not to because it wouldn't be as addictive. And it is possible. It's practically impossible to get acute nicotine poisoning from smoking cigarettes. You just can't smoke them fast enough. But as one of the other speakers said today, I mean, some of these e-cigarettes include the nicotine equivalent of a couple of cartons of cigarettes, certainly a couple of packs of cigarettes. And you can just sit there and just keep smoking it or keep inhaling it and get very, very high nicotine levels to the point where you get acute nicotine toxicity, which causes seizures.
Nick sick. All right. Well, listen, Stan, unfortunately, we have to leave it there. We always learn a lot from you, and we really appreciate your time. And we're going to wrap it up. So thank you for joining us, Stan Glantz. Thanks for all of that research.
That was so
well, thank you for having me. And I just have to say, I've watched the whole conference, and you guys have put a great conference together. I learned a lot listening to the others.
Oh, thank you. We really, coming from you especially, we really appreciate that, Stan. Thank you.